Let's discuss this now with Dorit Reiss. She's a professor of law at UC Hastings College of Law and joins us from San Francisco. Professor, thank you so much for coming onto the program. You're someone who specializes in vaccine law and policy. So do you think that the United States should be mandating COVID vaccines, especially for children between the ages of 5 and 11?
Thanks for having me. I think that the United States should recommend the vaccines for children 5 to 12, but I think it's too early to mandate it for that group. I think protecting children 5 to 11, 5 to 12 will save lives, will prevent harms to others. As a reminder, a lot of children who were not directly hurt by COVID lost caregivers. So reducing COVID in the family is good for everybody, but I think it's too early to mandate and parents need more time to get comfortable with the vaccine.
Professor, are there legal ramifications for those parents who choose not to vaccinate their children?
Not without additional state action. Right now, when it's a recommendation, if it's recommended today, parents have the choice. In the United States, vaccine enforcement on children is usually done through school mandates, through conditioning school attendance on getting vaccinated. To do that for COVID-19 vaccines, you'll have to have some state action to add the vaccines. Some states are considering it. California said it will mandate the vaccine, but only once it's fully licensed, which it's not right now. Other states are saying we're not going to do this.
Is it necessary to mandate vaccines if it comes to that? Like you said, in California, if they become fully licensed, is it necessary to bring out these mandates for children if there's also still this growing number of adults in the United States who are fully vaccinated right now?
I think we will have to see how the pandemic goes. We need mandates when we can't prevent pandemic and harms in other ways. That's why we have school mandates for other vaccines, because just voluntary vaccination did not get the rates high enough to protect children. So if we manage to stop the pandemic by recommending vaccines to children and maybe putting in place workplace mandates for adults, we do not need vaccine mandates for children. If we get to a point where COVID is still raging and children are affected and the community is affected, we may need mandates.
So still a lot of moving parts that regulators and lawmakers would have to look at in the situation. But overall, is a mandate on vaccines the best way to really get people to get those shots in their arms? Because there are so many people who are hesitant. There are also many people who say this is a restriction on their freedoms.
Vaccine mandates work. When we mandate vaccines, rates go up, and that protects everybody, including the ones that would not get vaccinated otherwise. So that's a plus for them. On the other hand, we really need to consider the situation. From my point of view, vaccine mandates are the least worst way when you don't have a better option. They're the best way to save lives right now when Delta is raging and vaccine rates voluntarily aren't going up high enough. But as you're correctly saying, there's a cost in terms of freedom, there's a cost in generating resistance, and we really need to balance those things. So as law professors like to say, it depends. Vaccine mandates are often the right answer, but not always.
Well, it does really seem like a balancing act and a difficult balancing act for so many countries right now. But Professor Dorit Reiss, really appreciate your analysis and your take on this, joining us there from San Francisco. Thank you so much.